We are still on the same subject of resuscitating a stroke patient. This is the part 3 of it. So what if the brain CT scan shows that the person is having hemorrhagic stroke, bleeding in the brain, ruptures in the arteries that supply blood to some part of the brain? How do you assist? How do you use natural measures to help such individual? Of course, this is a very, very difficult situation. The survival rate for this kind of a stroke is very, very low, depending on the severity of damage internally, depending on the severity of rupture, the amount of blood that is deposited in the brain. But if you actually want to give care using natural supplements or natural agents around you, plantain syrup has been very effective in treating such patients with hemorrhagic stroke. Plantain itself is rich in vitamin K, and vitamin K will help the blood to produce enough of protein. It will help the blood to produce prothrombin, a protein-dependent a vitamin K-dependent protein that helps for clotting of blood. And you can also use avocado spear, banana, spinach, cabbage, lettuce. These are fruits and vegetables that you can use to assist such person. But what about the deposition of blood that is already in the brain? How do you clean up such? Of course, there is no natural way of removing or cleaning up blood that is already deposited in the brain. We have said that survival depends on the level of damage. If it happened on a very low level, the brain itself, research work and experience shows that the brain itself is a fighter. There's a reactivation process in place, or a renewal process in place naturally that can help the brain to produce new cells, and that can help the brain to absorb some of these depositions. But in all cases, in the event of stroke, there will be partial paralysis, visual changes, impaired speech, and some other physical symptoms that will be present. So how do we generally help that person to come back to his feet? How do we resuscitate such individual from that state of paralysis? Watch out for part 4 of our video.